So, welcome to this session on a post-pandemic psychological health and safety in the workplace. I hopefully have listed post-pandemic, knowing that there will be a post-pandemic. And this session is all about how you can set up your workplace to understand the psychological risks and be able to ensure you have the right programs in place and the right processes in place to keep your employees healthy and safe. As we start, my name is Nancy Gowan, and I am from Gowan Consulting. Over the past 30 years, I have worked with employers and employees to be able to support their employees in staying at work or return to work through life's challenges. And we definitely know that this pandemic has been a challenge. So what happened last year, over a year and a half ago? We used to come into workplaces and we'd say hi to our fellow colleagues, and we'd work together in teams, and we'd have kind of coffee chats where we'd stop at the coffee maker, the water cooler. We'd talk about family, we'd talk about friends, we'd have some breaks. And as we came into work, we were energized and enthused and excited. But in March last year, things shut down, locked down. Many workplaces shut down, unfortunately. But those that locked down and sent people home, we became distanced. We became challenged by the pandemic. And our interactions changed, our workplace changed, and we ended up looking at computers all day long if we were working virtually. If we were an essential worker, we would be working as an essential worker, going out feeling unsafe, feeling like we were at risk of getting COVID, that our hospitals have numbers and patients that are overwhelming our ICUs, overwhelming our hospital staff, our first responders, our healthcare workers, our grocery store workers, Amazon workers, all those people going out to be able to keep us safe during lockdown. So we already knew prior to COVID that there were psychological risks in the workplace. And a study done by Willis Towers Watson in 2020 indicated that the global economic losses related to mental health disorders between 2011 and 2030 were estimated to be about $16.3 trillion. Comparable to those with cardiovascular disease, higher than cancer, higher than chronic respiratory diseases, and higher than diabetes. And that was predicted prior to the pandemic. And so we know that psychological risks in our workplace are important, and it's important for us to pay attention to what can we do to help and support our employees in staying psychologically well and reducing those risks, because the cost of doing nothing can be extraordinary. So an organization of approximately 2,000 employees can spend up to $37.8 million a year on losses, on risks regarding psychological risks in the workplace. We know that there are things like the tangible costs, the short-term disabilities increasing with respect to mental illness, the long-term disability costs increasing, the use of benefits, our employee assistance programs, but we also are getting more harassment complaints, more grievances, more conflict in the workplace, more challenges with respect to Zoom fatigue and the management of workload. There's bullying that's still happening online. We might not be together, but we still are having social challenges that are impacting our mental wellness. And so one of the things that you as an employer want to pay attention to is how your employees are feeling, and what are the things in your workplace that you can do to be able to maintain psychological health and safety. So I'm going to tell you a little bit of a story about a psychologist who had done a study with a mouse in a cage. And what did he do? Well, what he did is he put that mouse in the cage and he electrified a portion of the cage. So every time the mouse would go over to that portion of the cage, it would get an electric shock. And so the mouse would problem solve, get out of that area and get to safety and be able to then, go along with their day on a regular basis, feeling safe. Then the psychologist increased the portion of the cage that was electrified. And each time that mouse would go to that portion of the cage, get that electric shock and go, oh no, this isn't safe, problem solve and get to safety and get to be successful again, living in the cage. Finally, the psychologist electrified the whole bottom of the cage. And so what happened with that mouse? Well, he tried to get to the areas that were not giving him a shock, but unfortunately, he got a shock every spot that he went within the cage. He problem solved. He tried to climb the side of the cage, but mice aren't good climbers. He tried to do all he could to be successful. And unfortunately, what happened is he realized no matter what I do, I can't be successful. And he rolled up in a ball in a corner and he just took it. And so we call this the hopeless, helpless response. And so this is the same response that your employees may be feeling if they feel like they might have not enough resources, not enough time, not enough tools, not the right tools to be able to perform the job. They're going to start to feel hopeless and helpless. If they don't have the skills, the competence, they've been redeployed into another area, they're going to start to feel that hopeless, helpless response because they can't be successful without those skills. Or perhaps they're feeling unsafe. They are an essential worker. They have to go out and they might feel like they're going to get COVID. Or they're getting lack of clarity from their leadership in terms of expectations. And so they're feeling unsafe in the work that they're doing. Or perhaps they're feeling like they're not belonging, that they aren't being heard, that they need to know that they matter. Or they're feeling that they're treated differently than others, and there's just that unfairness, the injustice in the workplace. These are psychological risks that can cause your employees to feel like that mouse in the cage, to feel like they are psychologically at risk. And we're also feeling this in this COVID world where there's a new change that I'm locked in my house doing my work, and that's all that I can do because I can't do anything else. So those feelings are causing individuals to be at risk of psychological health and safety concerns, mental illness, mental injury. And I don't know an employee that comes to work and says, how can I screw up today? What can I do to make the worst mistake possible? Or to have conflict with my colleagues, or whatever else might be challenging that employee at the time. Employees come to work to be successful. They want to be successful. And you as an employer have a responsibility to find the ways that you can help your employee to be successful. But according to Howard HR, there is a joint responsibility for mental fitness. That not only does the employer have that responsibility to ensure that people have the resources, the tools, the strategies, the safety, they have positive customer interactions, they have justice and fairness in their work, they have good direct manager trust, good positive peer interactions. But the employee also has a responsibility to stay mentally fit, and they need the resources to be able to manage their workload, to be able to stay fit and to have boundaries, to have job satisfaction, to feel like they can have that work-life integration or blending, that they have good social connections, good physical activity, and good making lifestyle choices. So mental fitness is a process that takes both the employer and the employee taking actions to stay mentally well. Now, the psychological health and safety standard that was created in 2013 was a standard that provided a comprehensive framework to allow you as an employer to be able to take a look at your psychological health and safety. It included key objectives, purposes, and principles to allow you to be able to put into place the right plan, do, check, act process so that you can have a psychologically healthy and safe workplace. It's voluntary and it's not something that's written in law, but under the Occupational Health and Safety Act, we have to take every reasonable precaution to keep our employees safe at work. And that just doesn't say physical safety, but also psychological safety. So this framework and this standard allows you to be able to put that into place. It allows you to take a look at preventing psychological harm. Things like harassment in the workplace, trauma in the workplace. We want to take a look at how do we prevent the psychological risks that cause individuals to be harmed. We also want to promote psychological health. How can the employees have tools and structure within their day to stay psychologically healthy? How can they be mindful? Have the resources of EFAP, an occupational therapist, someone that can help and support them to promote their psychological health? How can they have training on resiliency and supports? And also, the psychological health and safety standard talks about helping to resolve incidents and concerns so that when someone has a psychological risk or an incident that causes psychological harm, how do we help them to recover and get back at the workplace, staying in the workplace? And so this structure and framework is a good framework to be able to look at in helping you to maintain your psychological health and safety in the workplace. But we've also structured it into several different categories of things to consider. Now, many of you, because this has been in place since 2013, might already have a structure in place. And so we're going to talk about what kinds of things do you want to review right now, getting ready for post-pandemic psychological health and safety. You might have already started to go down that path of assessing risks and setting your foundation, which is wonderful. If you haven't, let's start at the beginning. But if you have, here's some strategies and tools you might want to rethink of in the framework of the pandemic. So the first is, let's take a look at your foundation. Do you continue to have leadership commitment for psychological health and safety? Perhaps you need to relook at your commitment statement. Consider things like applying to, are we going to be moving into needing new and creative budgets and processes to support our employees post-pandemic? Are we going to need to be able to look at adjusting things to a hybrid model? What is our budget? What is our ability to support from a leadership perspective? And maybe our policies and procedures might need to be adjusted. But consider an emphasis on the importance of mental health. If you've spent some time with us in the last few sessions on Mindful May, you've heard about the statistics in terms of our mental health status during the pandemic and how it is declining and how important it is to have a workplace that supports mental health. But also we want to take a look at physical health and safety, like working from home, ergonomics, health and safety in a different workplace. From a prevention perspective, you want to complete another current risk assessment of the hazards that you have in your workplace. Things like working from home or the hybrid model. What are the new risks that might come about with respect to that psychological health and safety risk for our employees? Social isolation, work-life balance are all going to need to be reconsidered in this post-pandemic world. How can we ensure that employees are making sure that they have the supports to stay connected, to belong, to be able to help and get the support of their workplace? Having ergonomics at home, knowing that as an employer, you have a responsibility to look after the home workplace just as you did with the workplace in the big tower. That is your employee's workplace. So what are the hazards there? The psychological hazards, the physical hazards, the ergonomic hazards. From a perspective of the pandemic, you may want to be considering, how are we going to approach masking, vaccinations, physical distancing when we do return to the workplace? What are our rules and our obligations? How can we reduce the risk for our employees in that regard? You want to consider different supports to assist your employees in this new way of working. And perhaps that might be training for all. Considering our manager mental health training to ensure your managers know how to support your employees. Providing sessions on dealing with worry and uncertainty and crisis fatigue, or employee resiliency sessions to help to embed self-care and resiliency into individuals' work and home life. From an incident management perspective, you want to look at how can we develop incident reporting structures that allow employees to feel psychologically safe in reporting the hazards that they may be experiencing. Violence, domestic violence, harassment, gossip, customer harassment. We seem to have a different way to approach each other now that we're on screen. So you want to be able to look at, how can I ensure that people feel safe to report? And when they report, how do we help them as soon as we can to be able to mitigate that risk? Give them the right supports and resources. You've heard about the suicide statistics increasing with the pandemic. So as a workplace, we want to make sure we have a suicide prevention and postvention program in place. A critical incident stress management program for those who deal with trauma, who deal with the different risks psychologically in dealing with customers in the workplace, in the community. We also want to look at violence and harassment reporting and investigations, including domestic violence, because if your employees are working now from home or in a hybrid model, that investigation and reporting is going to be different. It's going to be adjusted to the new way of working. From an early intervention perspective, we have been hearing that employers are starting to invest in more psychological supports, which is wonderful. So some organizations have considered other benefit allocations, considering opening up the mental health supports. If your benefits program says psychologist or psychotherapist only, then you want to open it up to other mental health professionals to ensure that employees can get the successful mental health support that they need. Including occupational therapy in your benefits program is really crucial, because we can assist your employees in getting the mental health support that they need proactively and in a work-focused manner that allows them to stay working and supported. Some organizations are finding that their employee assistance program has a wait list, that crisis lines are having wait lists. So how can you as an employer put additional supports in place? Our virtual occupational therapy services and on-site services can provide that support proactively before someone goes off work. So consider putting that kind of process in place to support your employees now and into the future to stay functioning and productive and well. Consider things like crisis fatigue programs. How are we dealing with Zoom fatigue? Training your managers to be able to develop virtual coaching supports. Implementing the breaks within your day, not being on Zoom all day long, getting routine and structure that builds in micro breaks. 50-minute meetings instead of 1-hour meetings. Taking a lunch break, taking the breaks and setting boundaries. And being able to help your employees to know the kinds of things that they can do to stay healthy and well and decompress from their day. For staying at work, we want to make sure that we are early in identifying distress in our employees, being able to offer work adjustments, supports, resources for them to stay well and to recover at work. Putting in work accommodations like cognitive supports, symptom management supports for anxiety, for depression, for lack of concentration. And those are all things that we're doing every single day with the employees that we're working with to help them to stay well. So how can you implement good stay at work proactive accommodations to help your employees be successful before they feel like that mouse in the cage? Training your managers on mental health support for themselves and their employees, on dealing with difficult conversations. Our customers are dealing with individuals on a screen. And so unfortunately, they're feeling like their behaviors can become less or different than if we were in person. We're getting much more violence and harassment in terms of complaints on customer service lines because people are just taking it out everywhere and feeling comfortable in doing that screen to screen that they wouldn't do if you were in a face-to-face environment. So teach your employees about how to deal with those difficult conversations, what supports you have to be able to ensure that they can let customers know what is respectful and civil in their workplace. And we're finding that between workplace parties, colleagues, that civility and respect is being lost in dealing with this crisis fatigue. So help them to learn how to maintain civility and respect through some education, supports, and strategies and coaching. For return to work, you want to take a look at implementing a way of working with a disability management team to prepare individuals to return to work. This also includes those employees who may be working at home now, but you're planning to have them return post-COVID, post-pandemic, back into the workplace at in some format. So you may want to consider a gradual reintegration process, a process to help individuals with their worry, their uncertainty, their questions, and getting exposed and integrated back into the workplace in a healthy and safe manner, knowing that they can have the resources that they need. We've put together a TIPS program, which is a 4-session program to help employees to get from that worry and uncertainty to manage some of those unhelpful thoughts and to be able to plan for reintegration so that they feel safe and healthy and can plan how they will return into the workplace in a successful and sustainable way. We want to ensure that we have safety plans in our return to work programs for those individuals that are at risk of harming themselves or others, and putting emotional action plans in place that how do we help them to maintain their self-care, their resiliency, and helping to communicate with workplace parties on how we'll continue to work in this new either hybrid environment, work from home environment, or return to the workplace. So return to work needs to be part of your psychological health and safety plan. We want to maintain our mental health in the workplace by implementing good engagement discussions. Good discussions between coworkers, between managers, good coaching sessions, virtual check-ins, virtual social engagement. Teaching managers how to coach employees who are at the distance, who may be working virtually, how to manage productivity, attention, and getting some good job coaching for employees to return to healthy productivity. And in growth, considering, we have been away from the workplace for a year now. How have we continued our conversation around career growth? Many of the surveys that have been done have found that those individuals that are career focused have been suffering through pandemic to be able to maintain that engagement, maintain that excitement for career development. So as an employer, you want to consider, what are your career development plans? How are individuals still growing and getting the training they need to upskill for the new workplace? Working with your team to solve workplace issues, to solve issues that as a leader, you may feel like you are at a loss as to what to do. Bring your team in and have strategic planning and processes in place to help and support your leadership decisions. Teach your leaders to be authentic and vulnerable leaders. Allow them to be able to talk to their teams in an open and successful way, to be able to look at how can they support employees through this pandemic. And sometimes we forget to recognize and reward and congratulate the wins, that we've been lost in this pandemic world where we're just getting by. So relook at your recognition and reward program. How do we congratulate people through this crisis, support individuals, and be able to share wins and share successes? And we also want to take a look at evaluating the program. So are you collecting the right data to really understand what your psychological risks are in your workplace? How are your programs going? Do you have a mental health index that you do in your workplace that tells you how your employees are doing? A pulse survey, something that allows you to collect data to say, it's working, or we need to adjust and continually improve our program. So consider an audit of your psychological health and safety program. And this is a great time to do it, because this is an opportunity where our workplace is going to change. And so as our workplace changes, building psychological health and safety standards, outcome measures, and reporting that allows our leadership to see how the workplace is doing in our psychological health and safety. By implementing these programs, and these are just some ideas, and they don't apply to everyone. And so we would suggest that you want to customize your strategy for your workplace. And we can help you with your mental health strategy, with developing processes and programs that are right for your workplace to keep your employees psychologically healthy and safe, and collecting the right data and auditing at the right time. And what can you expect as an employer if you implement this program? You can see that you will have a more integrated and structured approach to managing mental health in your workplace. That you will have resilient employees that will come out of this pandemic coping better, having the skills to be resilient, to be successful again. You'll have an improved organizational bottom line. You saw the costs up front. Some of those preventative costs are going to lead to improved organizational success from a profit perspective. You'll have better employee engagement, cost effectiveness, and a better way to manage your risks, and authentic, supportive leaders and managers who know that part of their role is supporting employees in their mental health. You will also see it in your bottom line with your outcomes. Having reduced absenteeism, short-term disability, long-term disability, reduced incidence rates, better return to work cases and more sustainable and successful accommodation, legal compliance, and you'll have reduced turnover or vacancy rates, and being able to improve your productivity, your sales, and your success of your organization. So we would like to help you with your psychological health and safety in your workplace. You can start by signing up for our training, which is our psychological health and safety in the workplace training at gowantraining.com, which will give you the base education around psychological health and safety. And when we'll work together to develop your mental health strategy and implement the right programs for your organization. We also would love to consult on your current psychological health and safety program. We have a mental health and productivity audit that you can do for $149 that we can go through how you're doing right now and some suggestions for improvement. But check out all of our resources to help you. If you are focusing on your employees and getting the right services in place, we believe that an occupational therapist being accessible by your employees will improve their health, their productivity, and their ability to manage and their mental health resiliency. So give us a call so we can put in the right program for your organization and help you to become a psychologically healthy and safe workplace post-pandemic. So I know that we're at 1 o'clock, but I'm happy to take any questions in the chat box, or any questions if you want to unmute your phone. We're happy to take those questions, but I do appreciate your time. This is the end of our Mindfulness May sessions. And so let us know what else you'd like to hear from us. If you've joined us for our accommodation sessions and our mental health sessions, maybe you have some ideas on what else you want to hear about. Please email me, email us, and let us know what we can do to help you to support you and your employees in this process.